Now you're on the right medication for hair loss, but your hair is not growing. Even after you've had a hair transplant, your hair is not growing and you're wondering, did I go wrong? What am I doing wrong? This video specifically is for you, especially if you're doing everything that you're supposed to do. If you're coming across this video for the first time, my name is Dr. Chefu. I'm a hair transplant surgeon, a hair loss coach, and I've helped thousands of my clients regain confidence through hair regrowth and hair transplant. Now, I've had a lot of consultations, people coming to me, we're talking about why their hair is not growing, especially they're on the right medication, they've had a hair transplant, but their hair is still not growing. Now, my duty today is to help you understand the possible reasons why your hair won't grow, especially even after you've had a hair transplant. So if this is you, I need you to watch this video to the end because it might surprise you that you might fall into one of these people. You might be one of these people I'm talking about. Now, what I tend to say is that people miss a lot of steps before going for a hair transplant. Now, if you haven't watched my video about don't skip this step, you need to go watch it. Head over to YouTube. YouTube name is Dr. Chefu. Watch that video and know the steps you need to take before you get a hair transplant. But now I'm talking to people that have had a hair transplant and they are on hair loss treatments and their hair is not growing. This video specifically is for you. Now, one thing I tend to say is that most people just go for a hair transplant blindly, take the medication. But one thing I always ask you is that, did you get a diagnosis? What is the diagnosis? What kind of hair loss are we talking about? Are you dealing with? Now, do you know, or you just went ahead and had a hair transplant and just started minoxidil because you heard minoxidil is a miracle drug or is a miracle medication? You just heard that. So that's why it's very important. I always preach on this channel. You have to get a proper scalp and hair evaluation to get the right diagnosis. And if possible, a biopsy. You have to do that. So if this is you already had a hair transplant and you've been on minoxidil, my first recommendation is always to get a proper hair and scalp evaluation if you haven't had one before your hair transplant. If your hair is still not growing, you might need a scalp biopsy to figure out what is going on with your scalp. And that leads me to my next point. You might have some inflammation going on. You might have something called scarring or alopecia. I tend to see that a lot, especially with ladies that have gone for hair transplant and their hair is still not growing. And I always tell them, you need a biopsy, especially to figure out if you have some form of scarring or alopecia. So I don't want you to believe that you had a hair transplant, you're on the right medication and your hair is not growing. There's a problem and it's your duty. And you have a duty to yourself to figure out what is going on. So you need a scalp biopsy for that. Now, the next thing I have to disclose to you, the next reason why possibly your hair is not growing is, are you on the right medication? Now, how will you know which medication is going to work for you if you've not had a proper scalp and hair evaluation? Now, if you've not had a biopsy, how will you know what medication that will work for you? Now, a lot of people go ahead, start using minoxidil because they listen to everybody online talking about minoxidil. Yes, minoxidil is good, but it's not a miracle medication. It's not a miracle. It's not a medication you just keep using and expect something to happen. No, I want you to understand something. If you have some form of scarring or alopecia, you need more. You need to control that inflammatory process. If not, it's going to keep happening. Okay, so hair transplant won't save you. Minoxidil won't save you. So you have to get on the right medical treatment. Now, this leads to my next point. Maybe you're judging your hair too soon. Maybe you just had a hair transplant 2-3 months ago and you're expecting your hair to grow. No, it takes time. Your hair actually grows 1 centimeter every month. And if you divide it by 30 days, it's 0.03 thereabout. That it grows every day. So we don't expect to see any visible hair till at least 4 to 6 months. So maybe you need to slow down and take a deep breath and watch your hair grow. So don't judge your hair too soon. But now, if you've waited for 9 months and you don't see any visible hair growth, Now, that's a problem. You have to have a proper assessment and figure out what is going on. Now, this leads to my next point. Probably your hair is shedding. Yes. Now, your hair can shed early on, immediately after your hair transplant, within 2 weeks. And your hair can also shed a couple of months after your hair transplant, even if you're on the right medication. Why do I say that? If you haven't watched my video on the lab test you need to get before your hair transplant, head over to YouTube and go watch that video. There are a couple of lab tests you need to get before your hair transplant. Why do I say that? That can cause hair shedding. You need to check all your vitamins. You need to check your vitamin B12. You need to check your vitamin D. You need to check your ferritin level. You need to make sure that all those are within the normal range, especially when you're dealing with hair loss. So if this is you, your hair is shedding, even a couple of months after your hair transplant, go ahead and schedule an appointment with your primary care doctor so they can order this lab test for you and they can figure out if you are dealing with a nutritional or vitamin deficiency. Now, the next thing is that most people are quick to say my hair is not growing. My next question to you is that, are you taking your medication as you're supposed to? Have you been taking it every day diligently? Not skipping today, not taking it the next day. You tend to keep forgetting to take your medication. Is that your case? Then why will your hair grow? Ask yourself that question. So most people are quick to say that their hair is not growing. Meanwhile, they are not taking their medication as they're supposed to take it. Now, if this is you, you've been skipping your medication because you think that your medication is not going to work because you already had the hair transplant. Now, listen to this. Hair transplant is one part of it. Medical treatment is the other part of it. Both of them together helps you prevent further hair loss. So please, if you're one of these people I'm talking about that forget to take their medication, thinking that all they need is a hair transplant, I'm sorry to disappoint you. You need both of them for your hair to grow. And finally, there are other things that can make your hair not to grow, like systemic diseases, chronic medical illnesses, other scalp conditions, smoking, diabetes, especially if it's not controlled. So these are many more that can cause your hair not to grow. So if this is you, it's very important to control other medical illnesses before heading for a hair transplant. So with all this I've said, and you fall into any of these, one thing I always say is that for you to have a successful hair transplant, it doesn't start with the hair transplant procedure itself. It starts before the hair transplant procedure. So if you've fallen into any of these people I've spoken about, you didn't get a proper scalp and hair evaluation, you didn't get a proper diagnosis, you might not be on the right medication, you might need more than what you're taking other than minoxidil, you might have other scalp conditions, you might have other chronic medical illnesses, you might have uncontrolled medical illnesses. Even before your hair transplant, you might have some vitamin deficiencies, nutritional deficiencies. If this is you, I have only one recommendation how you can rectify it. Make an appointment with us. We have free virtual hair consultations 7 days a week. Make an appointment. Somebody from my team will get in touch with you, talk to you, find out where you're coming from and how we can help you. And if you do all this, I promise you, you will not regret your actions. But now, if you know someone that are also dealing with hair loss, they've not even had a hair transplant, but they're dealing with hair loss and they're thinking about a hair transplant, send them this video. This video will save them a whole lot of stress. They will actually know what to do even before the hair transplant. And until next time, stay safe. Bye-bye.